Hi, this is Patrick Horn, president of GAP. Thank you to our sponsor, Ardelyx, for their support of this FAQ video module.
Hi, everybody. I'm Kim Orleck. I'm a physician assistant who practices at Atlanta Gastroenterology Associates, which is part of United Digestive. I'm really excited to be here today to answer a few questions related to IBS medications. The first one is, how long should you give a medication before a patient sees a response? So it's really important to remember that with all of our IBS therapies, in the clinical studies, we see an improvement in constipation first. This is typically measured in the studies by the frequency of complete spontaneous bowel movements, and this is often seen as early as 1 week, a maximal improvement. Though it's fantastic that we actually often see significant improvement in as fast as a day or days when it comes to those bowel improvements. It is really important, however, that we remember that abdominal pain improvement can typically start to be seen as soon as 1 week, but we typically do not see maximal improvement in the abdominal pain component for about 6 to 8 weeks. It's so important we remind our patients of this so that if they have improvement in their bowels, but not in their pain or abdominal symptoms, that they do not discontinue their therapy just weeks into their trial. The next question I'm going to address is, how do we know if a medication is working? As you guys know, we don't have any biomarkers for IBS at this time. And so how a medication is working is really dependent on the patient's response. Before we even put them on a therapy, we want to talk about the extent of their symptoms. And it's really important to talk about all of their symptoms, including the constipation, the pain, as well as those other abdominal symptoms like bloating. To assess their response, we want to really ask questions related to all of those symptoms. And that is really how we're going to know if a therapy is working. The last question I'm going to talk about is, at what point does it make sense to reassess treatment? I will tell you in my clinical practice, and based on the timeline I just talked to you, where we know that, again, bowels improve first, but pain efficacy can take longer to see maximal improvement, again, about 6 to 8 weeks. I typically ask to see my patients back around the 2 to 3 month mark. At that point, I'm hoping not only to have improvement in their bowels, but again, also in their pain and abdominal symptoms. Thank you all for joining today.